So for this video presentation, I'm going to be talking about some of the basic information regarding traumatic brain injury. And this is going to be comprised of a definition of the traumatic brain injury, um, prevalence, characteristics, causes, classification, assessments used to diagnose a traumatic brain injury, as well as a few examples of some difficulties that students with traumatic brain injuries face within the classroom. My paper partner, Rebecca, is going to be talking about some specific challenges that students with traumatic brain injuries face within the classrooms and some strategies that can be utilized within the school system to overcome these difficulties that these students face. So I'd like to start off by talking about the brain. So the human brain is the most complex organ within the human body, and it helps us to do many things, such as helping us to breathe, to maintain our balance, to control our body temperature, and so much more. So, because the brain is so important and so essential to our survival, people go to great lengths to protect their brain. So, the brain is actually already protected by the skull, which is a bone like structure within our head that protects the brain. But we as humans like to do things such as wear helmets when we're riding a bike, or ride helmets when we're riding a motorcycle, or have safety cushions installed into our cars in case we get into a car accident so we can protect our head. But although individuals do many things to protect their brain, um, accidents still happen, and this is when someone gets something known as a traumatic brain injury. So, a traumatic brain injury is a TBI for short, and a TBI can be defined as a type of temporary or permanent brain damage that arises from head collision or movement that impacts the brain. The definition via the IDEA, or Individuals with Disabilities Act, is a brain injury that arises due to a physical and external impact, giving rise to complete or limited psychosocial or functional damage, which in turn negatively alters a student's academic abilities. This isn't the word for word definition by the IDEA, it is paraphrased, but it is generally still the same concept. So for prevalence of a traumatic brain injury, TBIs are unfortunately becoming a lot more common. They're actually one of the leading causes for disabilities and deaths in the United States. So the amount of brain injuries that have been recorded per year is remarkably high, but to have an accurate intake on the prevalence of a traumatic brain injury is difficult because a lot of traumatic brain injuries go undiagnosed or unknown by the person who has it. So, an example would be a concussion, which is a milder form of a traumatic brain injury. A lot of people who get concussions go undiagnosed because they don't even realize that they have a concussion. Traumatic brain injuries tend to occur in adolescents between the ages of 15 and 19, and this is because adolescents are more likely to engage in risky behavior, which is why they are more likely to get a traumatic brain injury. So, if an individual believes that he or she may have a traumatic brain injury, there's a lot of different symptoms that this person can look for to check to see if they may have a TBI. So, there are physical, cognitive, and behavioral symptoms. For physical symptoms, we have headaches, dizziness, fatigue, insomnia, slight distortion, and high sensitivity to noise and light. For cognitive symptoms, we have difficulties in concentrating, memory problems, slowed information processing, problems in verbal and nonverbal communication, and difficulties in making decisions and being impulsive. For behavioral symptoms, we have anxiety, aggression, mood swings, and variances in personality. So, for causes, a TBI can be caused by any type of crash, fall, or movement that causes some kind of damage to the brain. So, TBIs can be caused by a closed or blunt force trauma in which there is force to the head from events such as falling or vehicle crashes. Um, TBIs can also be caused by blast injury, in which explosives can cause pressure from the waves, which can cause injuries. So this would be the case of somebody who was a veteran in a war, if they were near an explosive, um, or an explosion, the pressure from the waves of that explosion may have given them a TBI. And TBIs can also be caused by a penetrating injury, and that is when the cranial vault is actually penetrated. And this is usually from a gunshot or knife wound. So, traumatic brain injury can be classified as being either mild, moderate, or severe. So, a mild traumatic brain injury is when the patient is completely awake and aware and is able to follow commands fairly easily. A moderate classification for a TBI is when the patient is conscious but drowsy and has a harder time following basic commands and usually has at least some sort of pain associated with the injury. And a severe TBI is when the patient is unconscious and therefore unable to follow any commands. So there are different ways that one can assess for or check for a TBI, and that is the Glasgow Coma Scale, or the GCS for short. And then there are also brain scans, which can be a follow-up assessment after using the GCS, and then using therapists to assess a TBI is also a good option. So, the Glasgow Coma Scale is the main assessment tool that is used to diagnose TBIs. And this scale utilizes the three criteria of movement, eye opening, and speaking functionality to assess the possibility of a TBI. So, this assessment is based off a range of numbers that span from 1 to 15 and indicate the chances of a TBI and how severe that TBI might be. So, if a patient receives a score of 13 to 15, this means that they have a mild TBI. If the patient scores between 9 and 12, this means that they have a moderate TBI. And if the patient scores between 3 and 8, this means that they have a severe TBI. So clearly, the lower the GCS score is, the worse the traumatic brain injury is. So those that have a lower score tend to need further hospitalization and diagnosis. So, a good follow up assessment after using the GCS to initially assess the traumatic brain injury would be a brain scan. So, there are CT scans, there are magnetic resonance imaging, which is MRI for short. There is diffusion tensor imaging, or DTI for short, and there is positron emission tomography, or PET for short. And these brain imaging scans help professionals to see what parts of the brain are damaged from the injury and how badly these areas are damaged, which can help with the assessment. So, therapists are also a great way to assess TBIs. So, there are occupational therapists, physical therapists, speech therapists, and neuropsychologists. And these therapists can also help in the assessment and diagnosis process by evaluating a patient on different things such as memory, balance, speech, and functional motor skills. And these assessments and evaluations are essential to finding appropriate treatments and therefore better outcomes for these patients. So, a person who's been diagnosed with a TBI may undergo many challenges, and this is especially true if that individual is a young student in school. So, being in an academically rigorous environment for multiple hours a day requires a lot of brain power, causing an individual with a TBI to struggle and be constantly challenged. So, some of these difficulties that students face are information processing, so having slower information processing, retaining new information, they have trouble recalling information, memory, staying focused, maintaining appropriate behavior, and bodily and cognitive functioning abilities. So this last slide wraps up my presentation on some of the basic information regarding traumatic brain injury. So I hope that you found this video to be interesting and informative and that you've gained some new knowledge from watching this. Thanks so much.